Dr. Fong, why don't you start out by telling us a little about yourself and how you got to where you are today?
Sure. I'd like to start actually by thanking Nalin and Vanshika for inviting me and allowing me to share my experiences with you. In addition to taking care of patients and loving that work, I really enjoy educating and mentoring. It's a personal passion of mine, so feel free to reach out. I will have my email address available to everyone who's attending. You can message me on social media. I'm here to help and support any way I can. I don't see those slides on your screen, if you can share.
All right. Can you see it? Is it good?
Perfect. So we'll advance to the next slide. So a little bit about me. I hail from Texas, and if you click again, you'll see that I got a bachelor's in biochemistry. If you click again, I actually also pursued a bachelor's in French. How is that possible? Well, in high school, I did advanced placement courses, and if you have that available to you, and you do well on the advanced placement exam, take advantage of claiming those credits. That will allow you to kind of get some of those prereqs out of the way, and allow you to open up your schedule as a college student to pursue courses you might not otherwise have pursued that you really just enjoy and are passionate about. And I highly, highly encourage you to study what you love during that time of undergrad years. Yes, do the prerequisites, do what you need to for the application, but you have so much time during the rest of your training in life to study medicine. Study something you're really passionate about that might help you connect with a patient or help you better understand your fellow human being that might not be available to you in medical school. I ended up going to UT Southwestern Medical School in Dallas and pursued an additional year doing an international medical exchange program. And through that opportunity, I got a distinction in global health. I love studying abroad, and I first just started in my undergraduate years. So I guess a pro tip for any high schoolers, if you're interested in learning another language, even if not, I highly, highly recommend studying abroad, staying with a host family, and seeing another culture and seeing what it's like in another society, just to open your mind. If you click again, you'll see the rest of my slide is about how much I love studying abroad. And I started learning French in high school. I actually didn't do very well on the advanced placement exam in that I made good grades, but my speaking wasn't there. Like in theory, I knew how to pass the exam. I knew how to write and read. My listening wasn't so great. But studying abroad really opened up that verbal skill for me. And once I kind of figured out how to think and speak in another language, I was hooked. I wanted to learn another one. So I was like, okay, well, French and Spanish, they're both Romance languages. I'll pick up Spanish. I, in undergraduate, did an accelerated Spanish program so that by summer of 2008, which is my sophomore year of college, I went to Mexico. I did culture courses and language courses there for about half the time, maybe about a month. And then the other half of that study abroad experience was shadowing in the public health hospital system and working alongside anesthesiologists and surgeons. In med school, there are opportunities to do mission work. I know at my medical school, in addition to being able to go to Haiti, which was a annual week-long event where we fundraise all year long. We bring in supplies and medications. We set up a pharmacy there. We see as many people as we can in 5 days. In addition to Haiti, my school had opportunities to go to Mexico, I believe. There are lots of opportunities to serve your community and also to serve places where there are resource limitations. And I think that's a good experience to pursue, especially if you want to learn a language. Because I am a Francophile, I love everything about French language and culture, and I thought medical French would be useful, particularly with the idea of using it in the future with Doctors Without Borders, which is a French organization. I went back to France during this 1 year abroad, this international medical exchange program, to learn medical French, to rotate on the French wards to see their healthcare system, which is much different. And what was really eye-opening for me, I thought I knew what I wanted to do in medical school. I thought, like, literally from high school, I was like, I want to be an anesthesiologist. I really am interested in everything at a molecular level, how different molecules can control the body, and wanting to harness that. But I realized that I love taking care of people too much. And the thing about anesthesia is you have to let go, right? After that procedure, you really treat their pain, you put them under, you wake them up, and then you have to let them go. So I didn't realize that until I rotated on neurology. And that was right before I left for France, is when I realized, oh my God, I fell in love with neurology. I thought I was committed and married to anesthesia. That's not the case. So going to France allowed me more time to really explore that interest. And I ended up doing 3 months of anesthesia in France and 3 months in neurology. And within a month on the neurology wards, I knew that's what I wanted to do. So I'm glad I took that extra year. And there's nothing wrong with taking an extra year or being a non-traditional. You don't have to zoom through this whole process from high school, college, medical school. It's okay to do something that's a little off the beaten path. And then as part of this international medical exchange program, I then went to Vietnam. Again, I wanted my French to help me. And on a personal note, my background is Vietnamese. My mother is a Vietnamese refugee. And I really just wanted to see what the healthcare system is like there, to see her culture, to see her country, maybe learn a little bit of Vietnamese. I was not successful in that. It's very difficult. And then after 3 months in Vietnam, I went to Peru, brushed up on my medical Spanish, was able to do a bit of neurology there, geriatrics, and internal medicine. And then more recently, during residency, there are opportunities to study abroad, even in residency. I was able to go to Chile for a week. One of my mentors who does global neurology work got funding to do a course in emergency neurological critical care life support in Chile. So we went, I translated the curriculum, I gave lectures in Spanish, which was a little stressful, but I did it. And then also for a week during residency, I think this was my 3rd year, I did a week-long elective in the Dominican Republic, which is pretty special. Colombia is in the Washington Heights neighborhood of New York. It's one of the largest diaspora of Caribbean individuals, particularly those who come from the Dominican Republic. So we have a strong partnership with them. And I got to see again how their neurology residents train, got to see their healthcare system, and learned a lot. Next slide. So with all of that schooling behind me came the real school, the on the ward school, which is intern year in residency. I matched into neurology at Columbia, and the program includes with it a year of internal medicine. So I did both of those in New York at New York Presbyterian. And I actually graduated from the neurology residency program in the summer of 2019. Next slide, or click. So after I graduated from residency, I pursued fellowship, which is just more kind of particular training in a subsection of neurology. And what I'm really interested in is where neurology and the immune system collide. And we most often see that in patients with multiple sclerosis. So it is a multiple sclerosis specific / just general broad neuroimmunology program. I can talk more about what sorts of patients fall under the multiple sclerosis diagnosis, or what multiple sclerosis mimics look like later on. But just to give a little overview of the program I'm finishing, it's a 2-year program. Half of that is spent in the clinic, direct patient care. The way they kind of parcel out your schedule is every half day is considered 10%. So I had 2.5 days of clinic time and then 2.5 days of pursuing research projects, catching up on administrative tasks, what's not included here. In addition to seeing patients in the clinic, I rotate through with the other fellows to see patients in the hospital, and we get consults. And for example, today I got 3 consults. We can talk a little bit more about that later. So as I said, lots of outpatient, but there's some inpatient exposure. And what does that mean? Literally, outpatient is just you're not in the hospital, whereas inpatient is you are. And that's what it, when people say inpatient, that's what they mean. It's that you're admitted to the hospital. Next slide. All right, so why neurology? Why did I pursue this? And Oliver Sacks has a lot to do with it. I don't know if you guys are familiar with this author, but I was introduced to him through one of my college professors, one of my favorite people ever. And when you encounter these professors, email them, hold on to them, just keep in touch with them. It's one of my favorite relationships, and mentor-mentee relationships, now more of a friendship that I've carried with me. And I think he puts it best about wanting to understand people and the person behind the body and the illness, right? Next slide. This book, yeah, just quickly go back. Just the book that he's best known for is called The Man Who Mistook His Wife for a Hat, so I highly recommend reading it. Next slide. So what the program director at Columbia Neurology once said to me, that neurology is humanistic medicine, and I truly believe this. Everything about you, your personality, your responses to things, your character, your virtues, your experiences, all of that is because of how your brain and nervous system developed and responded to environmental cues. And that could be just what you had growing up. It could be challenges you face as an adult. Even the wiring that happens after injury, there is a rewiring. All of that together composes who you are. And it's really interesting that we have learned so much about the brain, and it is yet the most complicated matter in the universe. There's still so much to discover about it. What's really rewarding for me in neurology is you build these long-term relationships with your patients, and many disorders, for example, multiple sclerosis, those patients may start to become, they may be diagnosed in their 20s, and we take care of them well until old age. Now, because of the advances in treatments we can offer, patients are living into their 60s and 70s, which I guess hadn't really been seen or appreciated before I was born. Before I was born, there weren't any treatments for MS. So we get to be there with them, and actually, like, one of the challenges in taking care of these patients is helping them navigate how to build a family, how to plan a pregnancy around all these medications, and we're there for them with that regard. And then outside of multiple sclerosis, just thinking about patients who have dementia, you get to know their family members, you see who they are at the stage. It's, a progressive disease. It's hard to watch, especially as the family has to come to take care of the loved one more and more. But you are with them. Like, yes, it's difficult. Yes, we don't have treatments for everything yet, but they still need a good doctor, a caring doctor that can help alleviate those symptoms to the degree that is possible in medicine, to treat and to research, to kind of advance the field for that patient. I find it very rewarding taking care of patients with neurological problems. Just a little bias about me, it seems like after medical school, there's a lot of what I would call neurophobia, because it just seems so complicated. I am actually a strong advocate of alleviating neurophobia, because I think it's really interesting. I think once you learn certain rules, it's actually not so scary. And also breaking down what seems like a frightening change sensation you have and being like, well, actually, this is what's happening. It's not so scary. This is what we're going to do about it, and we can make it better. So those are many of the reasons that I went into neurology. Next slide. We're going to play this clip, which I think is really illuminating. Hopefully the sound works. Can you do a sound check, Nolan?
Seven 7,000 years ago. Now, in the course of time, we've come to realize that different parts of the brain do different things. So there are areas of the brain that are dedicated to controlling your movement or your vision or your memory or your appetite and so on. And when things work well, then the nervous system works well and everything functions. But once in a while, things don't go so well and there's trouble in these circuits, and there are some rogue neurons that are misfiring and causing trouble, or sometimes they're underactive and they're not quite working as they should. Now, the manifestation of this depends on where in the brain these neurons are. So when these neurons are in the motor circuit, you get dysfunction in the movement system and you get things like Parkinson's disease. When the malfunction is in a circuit that regulates your mood, you get things like depression. And when it is in a circuit that controls your memory and cognitive function, then you get things like Alzheimer's disease. So what we've been able to do is to pinpoint where these disturbances are in the brain, and we've been able to intervene within these circuits in the brain to either turn them up or turn them down. So this is very much like choosing the correct station on the radio dial. Once you choose the right station, whether it be jazz or opera, and in our case, whether it be movement or mood, we can put the dial there, and then we can use a second button to adjust the volume, to turn it up or turn it down. So what I'm going to tell you about is using the circuitry of the brain to implant electrodes and turning areas of the brain up and down to see if we can help our patients. And this is accomplished using this kind of device, and this is called deep brain stimulation.
Next slide. Should it autoplay? Oh, wait, go back. That was like the second half.
Now, the first example I'm going to show you is a patient with Parkinson's disease, and this lady has Parkinson's disease, and she has these electrodes in her brain, and I'm going to show you what she's like when the electrodes are turned off and she has her Parkinson's symptoms, and then we're going to turn it on. So this looks something like this. So the electrodes are turned off now, and you can see that she has tremor.
Can you try to touch my finger? That's a little better.
We're now going to turn it on. It's on.
Just turn it on.
And this works like that, instantly. And the difference between shaking in this way and not is related to the misbehavior of 25,000 neurons in her subthalamic nucleus. So we now know how to find these troublemakers and tell them, gentlemen, that's enough. We want you to stop doing that. And we do that with electricity.
All right, next slide. So I got some questions, and I'll go through those as we advance the slide.
Oh. Sorry about that. Okay.
It's all good.
All right.
Okay, so my day-to-day, I would say this really depends on what stage of training. Currently, I'm seeing patients in the clinic 2.5 days per week, and typically a clinic day goes from 8 to 5. And for every new patient we see, they get a whole hour with us. Maybe about half of that time is spent getting the history, trying to really understand when did their symptoms start. Did it start really fast, or was it kind of a gradual? You can't really pinpoint exactly, but they noticed something was changing. And the thing about neurological symptoms, it's really anything that could cause a disability. For example, vision. Like, think about your five senses, right? You can see, you can touch, you hear, you can taste. So any of those that go awry could be a neurological symptom. Loss of vision, double vision, any kind of numbness or tingling I always ask about in patients who we're evaluating for possible multiple sclerosis. Whether they've had weakness, and that could be sudden like heaviness in an arm or a leg, tripping over their toe, having trouble walking. It could be an issue with their balance. Really, everything that makes you so functional and able to adapt to the environment is regulated through your nervous system. So just to give you an idea of the spectrum of possible symptoms, that's what we mean. In addition to that, language, thinking, memory, those are also ingrained into the nervous system. So we obtain a history, and then we do a very careful neurological exam. And of all the specialties, I would say neurology still very much relies on exam, and there are so many little tricks and reflexes and things you can look for that neurologists over hundreds of years have identified and described. And what's really cool is based on a pattern, a constellation of abnormal signs on the exam, you can pretty accurately figure out where the problem is in the nervous system, going from the brain through the brain stem, spinal cord, the nerves that leave the spinal cord, and the nerves that are actually in the limb going to the muscle, or even at the muscle itself. I would say neurology is like real estate in that sense, and that's part of the game, is that you learn, okay, based on what this part of the nervous system is responsible for, if that person has symptoms where it's not working, I feel like, or you can deduce that the problem is there. And now we actually have imaging and tests that can look specifically for what we say the lesion, looking for the lesion, and confirm your like guess or hypothesis. So I would say a typical day in clinic is seeing a bunch of patients. And then on my non-clinic days, it's playing catch up. So every patient we see will generate, okay, we want to order an MRI, we want to do a lumbar puncture, we want to do these blood tests, and let's follow up on those blood tests. Let me call back the patient, let them know what the results were if we have those. Really it's advocacy, calling an insurance company because a special approval is needed, or maybe we didn't get approval, so it's been escalated and now the doctor is advocating for the patient. And then like today, I also had consults. The consults I have are outside of multiple sclerosis, and what's really interesting is my field, just like neuro and immune, I feel like it intersects with a lot of other specialties. So with inflammation of the brain, you could see seizure. So I'm not trained in epilepsy, but I do get exposure to that, and I appreciate it because it keeps me sharp, or it keeps my skills honed in general neurology. Still seeing patients who have seizure. I may see patients who have stroke because of inflammation. I could see patients that have, outside, I guess, of neurology, this patient I was consulted on, they're actually getting a cancer treatment that is harnessing the immune system to target and treat their tumor. And because of that, like new treatment, they need neurology on board to see the patient, do an assessment, what is their neurofunction, and really what that means is what is their normal mental status, or what is their normal like level of education, what's their normal language ability, because if something goes off and the treatment causes confusion or the treatment causes inflammation of the brain, we want to know what they look like before the treatment. So that's basically what my consult will be, is like getting to know these people, getting a sense of what's their educational background, doing what's called a MOCA, which I guess you may know that President Trump took a MOCA and bragged about getting 30 out of 30. I actually have one of these blank ones. Like, you have to identify, excuse me, these animals. It's a really difficult test. And I don't know if anyone saw the meme where he had to like remember the 5 words, and I'll tell you the 5 words he had to remember are not the standardized test 5 words, and they're definitely much easier for him to remember than what's on the test. What else? And then like tomorrow, so today was a non-clinic day. I took some meetings. I prepped for this presentation. I'm going to see those consults, and then like particularly today, the residency program I'm at, we do get-togethers and have happy hour on Thursday, so I might do that after this. But the day is different. Like if you're in medical school, much of your day is going to be spent studying, and that can look like attending class, which I didn't always do because nowadays we have all lectures on video. And I guess now the reality is I have a cousin who's in his first year of medical school, and he has a completely virtual curriculum. So you watch the Zooms, and if you get really good at watching at 1.25 or 1.5x speed, I highly recommend doing that. What else? And then as a resident, you know, in your intern year, you're working the hardest. You're the first person in to see the patient. You're the last person to leave. That can be a longer day, and but it's kind of like fast-paced, rewarding. You're on a team. You're taking care of people. You're doing the exam in the morning. You prepare for rounds, which is just when you talk about all the patients together with the attending, who's the one teaching and supervising all the residents, kind of the most experienced doctor on the team. You write notes, you get in touch with family members, you have lunch, hopefully, put that in. And then if there are new patients that are being admitted, depending on if you're admitting that day, you'll admit patients and then come back next day and do it all over again. I guess I'll answer more pointed questions later on. We can go to the next slide regarding day-to-day. What major challenges have I overcome, and how did I overcome them? I mean, there are many. We all have challenges to face. And actually, I read a quote from Serena Williams this week that really speaks to my outlook on it. And she said she learned her greatest lessons in the setbacks and not in the successes. And I think that's absolutely true. One topic I'll touch on is imposter syndrome, which I think is rampant either at the very early stages of trying to prepare and get into medical school, through residency, and even beyond residency. Why is it that way? I don't know. It is very common. So I want everyone to know that if you're going through this, I guarantee whatever you feel in terms of self-doubt, in terms of intimidation, in terms of if you're enough, everybody is feeling that. And maybe we could all like be transparent and open about that, and it would be almost comforting to know that everyone is going through the same thing. You don't have to go through it alone. So I definitely encourage having your core group to study with, to kind of confide in, to share with, and not to be afraid of those feelings. I think they're normal. They're a natural part of it, and you will overcome them. It's very challenging to get into medical school. It's almost like preparing you to be steadfast, stubborn, tenacious. So keep up those attributes and habits. And then I would say part of imposter syndrome is something called burnout. And I think part of that is just the system of medicine, healthcare training. It's a lot. You know, we work a lot of hours. we are paid kind of not fully paid our value as trainees, and we provide a lot of service to our patients. And sometimes there are moments where you will feel like you have lost what makes you you, and you're just kind of like going through the motions. And I think just being open and talking about it and kind of sharing those feelings, and again, having a strong social network, family, friends to confide in, is really important to build, not just, now in college and in medical school, but beyond. And I highly recommend getting into an exercise regime to help address those stresses, to help kind of combat the mental and physical stress of this kind of training journey. And there's therapy if you need it. And maybe it is stigmatized, but I don't think so. I think it's equally important to address your mental wellness as your physical wellness. So those are both very important. Next slide. What do I want to share about pursuing this path? I guess I already shared some things I wish I had known. I would say be yourself. Everyone else is taken. Be true to your passions. Listen to that inner voice. And, in college, as long as you do all the prerequisites, if there's something you really want to take a class in, you may never take a class in that again. And for that reason, it was important to me to pursue studying French, because I had claimed all of these credits from AP classes as a high school student. It allowed me to pursue studying French. And I'll be honest, I didn't really like biochemistry. I pursued a major in it. I took the class and I was like, oh no, this is my major, but it is not intuitive to me at all. I actually really liked physiology, so I would recommend doing that if you're a biology major. But just find a major in a topic, in a subject area you're really passionate about. I think that's important, especially at that stage of life. I also think it's important to not be too harsh on yourself, especially if you fail. As I said before, it's the setbacks that teach us the greatest lessons. And I also read somewhere that there's no growth in a comfort zone, which I think in retrospect as a 30-something-year-old is so true. And I wish it weren't, but it is very true. There's no growth in a comfort zone. So just realize that the struggles and the challenges you face will make you a better person. You will grow from it, you will learn, and it will help you serve to a better ability. I certainly think that, given my experiences. And you'll find, and again, I just want to normalize this feeling, because I'm sure everybody here, they know how important grades are. You have to get good grades to kind of go on this path. The further on this path you get, the more talented the pool, the more gifted and creative and intelligent the pool. Just remind yourself that you belong there. Don't compare yourself to others, you have value that you bring, and be inspired by your peers. Don't be threatened by them. I think there's unnecessary competition. We're all here to come together as a team someday in medicine to better or advance patient care and treatment. So I think it'd be really helpful to have that mindset from the beginning, and it'll save a lot of grief and strife down the road. I'll also be transparent about the fact that a career in medicine requires a lot of sacrifice. There's a lot of time spent studying, which translates to missing some social events or missing some birthdays, and even during intern year and residency, missing major life events like weddings or holidays. And it's hard, but you will get through the training process. And I feel like now that I'm on the other side of it, I'm able to reconnect with all of those people that I couldn't have as much of a social contact with because I was just so busy. You are so busy. But it's okay. You're there to learn and save lives, and literally, no matter what field you go into, the work you do is for someone else's benefit. It may even benefit one of those friends that you couldn't see in that moment, but you have the rest of your life to be there. Just because you miss one thing is not the end of the world. And along the note of studying a lot, working a lot, there's a lot of sleep deprivation. And again, that's just like temporary. Residency is 3 years at the shortest and potentially 7 years neurosurgery. So you can catch up on sleep, I guess. Sleep now. I see a few more questions have come in. Let's see. I've become interested in neuroscience over the last few years. I'm just not sure what I want to do with that interest, which path to take, or initiatives to make as a high school student looking to go into the science. That's a good question. I would say if there is, if you read something in the lay press, typically those news releases come out on a Tuesday when scientific journal articles publish. You can try to find the original article. And then from there, if you go to the original article, you can look at who the authors are. And there's usually a corresponding author. And I actually think many scientists and doctors welcome a cold email. It's really exciting to see someone who's interested in your field, and that could open up a shadowing opportunity. Who knows? I encourage that initiative, and I don't have any more brilliant ideas, but if you wanted to email me, we could set up a chat and just go over what else you could do. But try to read as much as you can. And I guess for me, I like reading about applied science, applied medicine, how does it really relate in the real world when it comes to patient care. Which is why Oliver Sacks, The Man Who Mistook His Wife for a Hat, is such a great read. And also, Oliver Sacks wrote a book called Awakenings, which was made into a movie with Robert De Niro and Robin Williams. It's a great movie. Watch it. Next question. For high school students, what extracurriculars or activities do you recommend for those wanting to learn more about medicine? If there are volunteer opportunities through some sort of family medicine practice or some sort of community drive where they're checking blood pressure, I think that would be a good opportunity. You might interface with doctors. You can get to meet people who are at these community fairs. You might learn how to use a blood pressure cuff and learn to take blood pressures. I remember in high school, there was specifically a medicine terminology course or some sort of health first aid that was taught by a nurse, and I learned a lot. Certainly if you take a class learning kind of the medical jargon and the language of medicine, that will be really helpful. As a high school student, I'm not sure if you can apply to be a medical scribe, but kind of along that idea of learning the language of medicine. Medical scribes are probably a good access point. What else? For high school students, I'm not sure. I would say find whatever your passion is, whatever student organization it is. It doesn't even necessarily have to be medicine related. Be committed and throw yourself into it, because when medical schools are looking at your resume, they want to see that you found something you love, and they want to see you grow and evolve with it. And then what did you bring to it that was fresh? That was your twist on it. So that's what I recommend. How do you recommend someone with a full-time job get involved with shadowing or participating in neurology? That is tough. I would say cold email people. I'm actually going to start practicing. I'm going to actually move to Seattle. So major news. I live in New York. I got my first job. in Seattle. I'm moving there and I will be starting my clinic in January. I actually don't know what the rules are for shadowing, but I would love to have people either in person or virtually. We'll figure it out. So you can email me and we'll figure it out. What was my favorite experience through medical school? That's a hard one. I mean, it's like feast and famine, trials and tribulations. You're like in the trenches studying, and then once you have that exam and it's over, you celebrate. So it's a lot of that. It's like a cycle, you know, like learning a new unit. It's a lot of stuff. They like compare the curriculum of medicine of medical school to like drinking from a fire hydrant, and that's accurate. It's a marathon, you guys. But you know, it's hard. You learn a lot, learn with your study buddies, and then celebrate. And then I guess what has enriched my medical school experience were those trips abroad. So I guess my school had this very unique opportunity, and again, like a plug for UT Southwestern. They have the International Medical Exchange Program. I don't know like what's happening because of the pandemic. I know that those who went had to come back home, unfortunately. But that was really memorable for me. Like because of that, I felt I could really explore neurology when I didn't expect it to be what I loved. And I did it in a much longer time course because you only get up 4 weeks of neurology, typically in medical school, and I did that plus an additional 3 weeks. So I really gave it a tried and true test, so to speak. And then living abroad, I really love that. I can't say enough how much I love studying abroad, and you should pursue it. I remember in a prior Zoom, someone asked me how I was able to afford it. And I'll be honest, I was a hustler for scholarships. So talk to your financial aid office, figure out all the scholarships that are available. Generally through a language department, they have a program set up, they have scholarships. Apply to all of them. That's how I did it. I hustled for scholarship money. How do you recommend getting over a low GPA when applying for medical school? That's a good question. I think you have to demonstrate, like, okay, this course was difficult. Did you have a trajectory where even though you didn't get the grade you wanted, you were able to pull up your grades over the semester? Was that in your freshman year? What was going on? Like, were there things going on in the family? Were there other stressors happening that really detracted from your focus? Or was it that the instructor just really didn't teach in your style and it was really hard for you to absorb the material? There's so many things that can kind of interfere with your success in a course. It's not necessarily because of you. So I think you could consider redoing the course to demonstrate that you can master more of the material, show your dedication. If you found that a study tactic didn't really work for you, kind of re-explore, well, what's the best way for me to learn? Am I a visual person? Am I more of a hands-on person? Do I really absorb well through audio? I have a younger sibling right now who's in her sophomore year, and I think for her, she's always had some natural ability to do well, and now she's being tested because we all need discipline, and part of going through college and medical school is applying structure to your learning and really being disciplined about it, being intentional with your learning and reviewing and repetition. It's not easy. You're not going to get it the first semester. It's something that's evolving with time. I'm even still refining my learning methods. So I think just be kind to yourself. It was a setback, but there's a saying, a Japanese proverb, you fall 7 times, get up 8, try it again.
Yeah. That's great. So we're going to take a few more questions, and if anyone else has any more questions, why don't we send them over to you, they can email you and ask some more, I guess. Because I believe you added your email to the slides.
Yes.
Yes. Okay, great.
Yeah, slide, if you put it up, has my media handle and my email again, I think.
Okay, great. That is awesome. I believe there are 2 more, so why don't we just
All right.
go with that?
Was med school harder than undergrad, or was it just more condensed? Oh yeah, med school was way harder than undergrad. No question. What was your favorite country to study abroad? I mean, that's like trying to pick a favorite child. They all are special. I spent the most time in France, and I guess like if I had to go back to a country, I've gone back to France. I got engaged in France. We did engagement photos in France. I couldn't get married in France, but I definitely tried to emulate that French feel in my wedding. So I'm obsessed with France is the message.
I love that. So,
Yeah.
So I just want to thank you for being here today. I loved your slideshow, first of all. I loved it. It was so detailed, and the videos, that was amazing. And we're so thankful for the advice you gave us and your experiences, especially about traveling abroad. So overall, thank you for coming.
Thank you so much for your attention. I hope it was helpful, and you're welcome to email me, or if there's another chat, if you need advice on applying for colleges, applying for medical school, virtual interviewing.
Yes.
You know how to find me.
Yes. So the Gmail's right there, and then Twitter and Instagram.
All right, well, enjoy the rest of your night, guys. It was a pleasure, and until next time.
Bye.
Bye, everyone. Thank you.
Yes, thank you for coming.